I just wanted to follow up. You made a reference to the minimum wage, and in recent articles in newspapers that I've been reading across the street, it's acknowledged that the department has a desire to increase staffing levels for nursing homes. At the same time, we hear your support for the minimum wage, and the governor's proposing this increase in the minimum wage. So my question is this: for our nursing homes that have been flat funded for the last 5 years, and they're being reimbursed, I'm told by some of my nursing homes, it's nearly $30 less per resident than the true cost of their care per day. How does your department intend to help pay for a staffing increase with a higher minimum wage?
We are working, as we are with the hospital regulations, to update the nursing home regulations. That is a process that's going to go to the governor's office by the summer and then go through that whole process. So we're really looking at a couple of years. We have not made a final decision in terms of staffing ratios for hospitals or nursing homes. If there was a staffing increase, then with discussions with the Department of Human Services, that might be how the Medicaid rates increase. So that none of that's been decided yet, but I think one of the issues in terms of increasing the Medicaid rates, and again I'll defer to Secretary Miller, is to ensure that that money goes to improved quality of care and not siphoned off for profit. And so one way of doing that is to increase staffing ratios. And so the idea would be to balance it. Nothing is going to change with the staffing ratios until the regulations are promulgated. But I would like to emphasize I think that having a living wage really improves the health of the community, and it does improve the health of seniors as well. I think that if seniors, if you have a living wage, then I think people have better health through the social determinants of health, and thus they'll be better equipped to potentially even live at home and not have to go to a nursing home. So I think that the minimum wage and having a living wage improves the health of the community and the state.
Well, and I certainly can see where you're going, but would say that any impact that would have would probably be a long-term effect. And I would say, I know that the Department of Health and the Department of Human Services have been working more together, and this is one of those areas where I really think you have to work together on those issues because, Department of Health is the agency that sets those requirements, and Department of Human Services the agency that reimburses those requirements. So you can't really increase requirements without fully understanding the impact that it's going to have on funding. So I would say that this is something that needs to be well thought out, and we can't just all of a sudden say we're going to do this without a sense of where that money's going to come from, how we're going to pay for it.
I understand. Thank you.
Thank you.